Good day friends, I'm Dr. A.S.K. Gupta and I'm going to talk to you about the first trimester ultrasound. First trimester ultrasound is something which is very common and most of the people just measure the crown rump length and forget the rest. And in fact, first trimester ultrasound is an opportunity to see the fetus in detail. If you see it carefully, you find that there is a spherical structure over here. I'll just show you. There is a spherical structure over here. This is the spherical structure over here. And this spherical structure is nothing but the yolk sac. And this fetus is around 10 weeks, 5 days. But the yolk sac is still persisting because the yolk sac appears at 5 weeks of gestation and remains up to 14 weeks of gestation. And the yolk sac suggests that this pregnancy is an intrauterine pregnancy. And you will all appreciate that the yolk sac has to be around 6 millimeters in size. A large yolk sac or a calcified yolk sac suggests that this pregnancy might be failing. And the yolk sac is a extra amniotic structure, and if you see carefully, you can see that these are the amniotic membranes. This you can see the amniotic membrane, which is clearly seen, and the yolk sac is seen outside the amniotic membrane, so it is nothing but the yolk sac. And what is the other significance of yolk sac? It confirms that the pregnancy is a intrauterine pregnancy, and in this patient you can see that there is a vitelline duct very clearly seen. And yolk sac is one thing which provides nutrition to the fetus, but as the placenta starts developing, yolk sac starts shrinking and disappears in most of the fetus by 13 weeks of gestation, and it may persist up to 14 weeks of gestation. This is the fetus, and you can see this is the rump and this is the crown, and the total length from the rump to the crown is called as the crown rump length, or the CRL. And this is the way we measure the CRL, and the CRL is fairly good diagnostic of the accurate gestational age. Rather, it is better than the multiple parameters including the BPD, AC and the FL, and it is valid up to 13 weeks of gestation before the spine starts developing and takes a curvature, because here the curvature of the spine has not developed, so the crown rump length is a fairly good diagnostic measurement for the ultrasound guided gestational age. You can see clearly that there is the nuchal translucency over here. I'll just show you it again. You can see that this is the nuchal translucency, and this nuchal translucency has to be less than 3 millimeters. It is here around 0.2 millimeters in width, and it suggests that this nuchal translucency is normal. Nuchal translucency in the first trimester may be the earliest sign of developing hydros fetalis. This is the nuchal translucency here in this scan. In case the nuchal translucency is increased, and it might be seen all across the spine and the skull, a translucent line might be extending, but it is maximum behind the neck, so it is to be measured at the level of neck. You can see clearly that these are the eyeballs which are developing, and this is the face. If you see in detail the face, then you can see that there is a shiny line in the region of nose, and this is nothing but the nasal bone. One has to be very careful looking for the nasal bone, because the absence of nasal bone or the hypoplastic nasal bone may signify the presence of Down syndrome. And if you see carefully, if I tilt my probe just away from the skull, then I find there is a limb-like structure over here. This is a limb-like structure. This is nothing but the upper limb which is in formation. These are two bones of the forearm, ulna and radius, and this is the hand which is developing, and this is the humerus. The other hand should also be visualized to detect the abnormalities at the early stage. After having seen the upper limbs, we should look for the lower limbs, and you can see that the lower limbs are well visualized, and these are the both lower limbs which are seen. The femur, the tibia, fibula, and the feet are also visible, which are in the form of development. So this fetus has all the 4 limbs which are visible at 11 weeks of gestation. And to see whether the fetus is live or not, you can see that there is a fetal cardiac activity which is normally seen. And it suggests that the fetus is a live fetus, because in the first trimester, the live fetus is very important. And after having seen the nuchal translucency and the nasal bone, the next thing to see obviously is the ductus venosus flow, and you can see here in this video that this is the cross section of the abdomen, and this is the umbilical cord which has developed and it is inserted in the developing placenta, and in the center of the abdomen you find there is a structure which is showing aliasing, which is nothing but the ductus venosus. And if I take the Doppler, the power Doppler across this ductus venosus, I find that there is a ductus venosus flow which is normally seen, and this flow in the diastolic notch there is some reversal with the flow which is normal in patients with the first trimester of gestation. So this is a normal ductus venosus flow in the first. You can all see that this is the umbilical cord which has started developing and it is inserted in the placenta on one side. And if I measure the umbilical artery Doppler flow, I find that this is the Doppler flow of the umbilical artery, and you can find that there is hardly any diastolic flow because it is a resistive flow, and the pulsatile flow in the umbilical artery develops during the second trimester of gestation, and this flow in the umbilical artery during the first trimester of gestation is a normal flow. I hope we have been able to describe the most of the details of the first trimester pregnancy. Of course, the abdomen and thorax should also be screened, and it is usually visible without any specific parameters. The kidneys cannot be seen in the first trimester. Intra-abdominal structures are just visualized like that, and this nearly completes the examination of the first trimester. And in case you like our video, please do subscribe to our channel. Do not forget to press the like button and share the video among large number of our friends so that maximum number of people can be benefited. Thank you very much.